Well, good morning and welcome back to Williamson County. I'm glad that we can meet together virtually. I think you'll be delighted at the end to hear from Dr. Greenwood, who's the medical director for Family Hospital Systems, and we'll give an update there. I want to give a general county overview and update on the COVID vaccination response through this morning. We have vaccinated 52,176 folks here in Williamson County, and we're beginning to move at a higher rate of speed, really doing a really good job in multiple areas. Just this past week, we had the vaccination locations at Kelly Reeve Stadium, and for the first time, we had a vaccination location at the Georgetown ISD football stadium. And it was a bit of a test run, but it went really well with about 1,100 folks being vaccinated this past Wednesday. Williamson County, effective today, will be assuming the maintaining of the waiting list for folks here in Williamson County. So regardless of which provider you may be vaccinated with in the days ahead, or which provider will be providing vaccinations, Williamson County will be maintaining that database of the waiting list. You're going to be impressed. You can go to wilco.org. It should be up and running by noon today, but wilco.org, and just simply look at the waiting list. What's unique about it is you'll be able to put in some identifiers for those of you that have already registered for the waiting list. And by the way, everyone that is registered for the waiting list will be imported into the system, and you'll be able to check your status, not necessarily your place in line, but you'll be able to check your information to make sure that it's correct. It's also really helpful too, if you've already been vaccinated somewhere else, it's an opportunity for you to remove yourself. Please remember that there are well over 100,000 people that are signed up on the waiting list. And if you've gotten vaccinated somewhere else, it'd be really helpful if you would remove yourself from that list. This past Wednesday, we started our call center here in Williamson County to help answer vaccine-related questions. And just in 3 days, we received 16,303 telephone calls. That's at our phone number, 512-943-1600. Now, the first couple of days, we just struggled keeping up with demand, and in fact, we couldn't. And we have beefed up that area by adding additional personnel and the technology to help us answer those phone calls. We definitely want to be there for all of our residents who need someone to talk to over the phone. Our technical assistance centers, our Vertus centers, are off and running. Our Sun City Vertus Center is up and running again today, and we're really excited to announce the second Vertus Center is up and running this week, tomorrow at First Baptist Church in Taylor. The address is 2500 Mallard Lane. Beginning on February the 9th, that's tomorrow, they'll be open every Tuesday and Thursday from 9 to 3 p.m. So if you need some help with getting on the waiting list, or if you have questions, or you can't operate technology and you want someone to help you, you'll be able to go to the Vertus Center in Taylor for that assistance, as well as our Sun City Ballroom. That is at 2 Texas Drive here in Georgetown. And that facility's operating hours are Monday, Tuesdays, and Fridays from 9 until 5 p.m. And then next Monday, we're launching our third location, which will be Hill Country Bible Church, and the address is 3300 Little Elm Trail, and that will be in the gym building, or the gymnasium building there in Cedar Park. And so starting on February the 15th, they will be opened every Monday, Wednesday, and Friday from 9 until 3 p.m. So our Vertus centers are up and running, they're trained, they're doing really an exceptional job, and we're appreciative of that. I will tell you, just anecdotally, this past Friday, our Vertus Center in Sun City, in one day alone, with about 20 county employees, was able to assist and help over 500 residents. So we're trying to put the resources out there to help the people and to help them be successful. I want to talk a little bit about the vaccine distribution this week, and I want to talk about it from a kind of 30,000-foot view. And then I'm going to ask Dr. Greenwood to give you a more granular view on what they're doing at FHS and how that affects us. This week, Williamson County is receiving 9,700 vaccine doses. And on Monday and Tuesday, those doses will be administered at the Kelly Reef Stadium by FHS. And then on Wednesday will be another inoculation day of 1,500 folks at our Georgetown High School athletic complex. I'm going to have to put on my glasses to read because we have a lot of new participants this week that are really helping. And I think what you will see is that agencies and entities are working together to solve problems. And as county judge, I'm amazed every day at the humility and the servant's heart and the working diligence of everyone to work together. And these are some examples. This week, for example, there will be 700 additional doses provided to nursing home and long-term care facilities. A newer facility to us as far as vaccine administration is starting this week. The WellMed Center in Leander has received 400 first-time doses. There's been 100 doses for the Lake Air Med Center here in Georgetown. The health district, in fact, has received 1,500 doses, 500 from last week and 1,000 this week. The 500 from last week are being directed exclusively to our long-term nursing care facilities and our senior care facilities. Our health county EMS are doing an amazing job at locating those entities that haven't been able to vaccinate our seniors. Our seniors are our most precious crowd, and for those that want it, we want to get shots in arms. As well, that health district will be shifting over 1,000 doses. 500 of those will go to Samaritans in Leander, and another 500 doses will be going to Sacred Heart in Round Rock. Samaritan and Sacred Heart are both facilities that care for those that are uninsured and often those that are indigent. So we're really grateful at the collaboration, not only between our family hospital systems, other providers that are receiving doses, as well as our health district. It's also understanding, and we don't know the particular numbers, but that our CVS or one of the CVSs here in Georgetown will be receiving doses as well. There's another 100 doses or so that are being provided to Lone Star Circle of Care in Cedar Park. And I think that covers about the list of the 9,700 first doses that we have for this week. This week is not going to be complicated. All of these entities are exceptional at administering the vaccine, and they do it really well. Next week is when it gets complicated, because next week, not only do we have the first-time doses that are coming in, but we'll begin to see large quantity of second doses coming in. So this week, 9,700 first-time doses, plus the additional second-time doses for this week, which I expect will be another 1,000 to 2,000 doses. But the following week, it's going to get really complicated. Very thankful for our partnership with the family hospital systems. They have done nothing but say yes every time that the county's had a request. Very fortunate. Dr. Greenwood is the Chief Medical Director of Family Hospital Systems, and he's here to give you an update on the particular vaccine administration for the hub for the county. And then following that, if you have questions, if you can put those in writing in the chat, and then Dr. Greenwood, Connie will be diverting the questions to me or you that's most appropriate. So again, we're grateful that you're all participating today and helping us get out the message, but we're making progress. Now, with that being said, one last thought before Dr. Greenwood speaks. For us to vaccinate the 1A and 1B population in Williamson County is about 210,000 residents, or about 420,000 shots. If we continue to get 8,000 to 10,000 doses a week, according to my math, it will be sometime in June before we even finish with 1A and 1B. So this is a long slog, a long haul, and it's going to be complicated, and we've all got to work together. Williamson County is doing a really good job. It would be helpful if we had more doses. So we'd be grateful when we get more from the president, the White House, and from our state authorities. Dr. Greenwood, thank you for joining us today.
Thank you, Judge Gravel, and I have the same sentiment as you. Our partnership has been, I'm very grateful for it, and it's been nothing but yes from our Williamson County leadership. Very grateful for taking the wait list. That was definitely a burden. There's just the need is huge. So I appreciate the help with that. And these Verta centers to me are just so instrumental. We really struggled getting those who can't navigate computers very well and getting them in the system. And so this is very beneficial. So thank you for getting those set up. So far, over the last 3 weeks, we've done about 22,000 first dose vaccines. We use the stadium parking lot setup in order to do these large quantities because it helps socially distance as people stay in their vehicles. And, we're doing 12 lines at a time, and we're doing, one vaccine every 2 minutes. And that's what has allowed us to get up to these large numbers. And your math is correct, Judge. It's gonna take a lot of time. But if we can increase the quantity in the meantime, then we can get those things done quicker. And of course, every week we are requesting more and more vaccine because we know what the math is, and we're just trying to get everybody done as quickly as we can. Like you mentioned, we do have the second doses, a large amount of those starting next week, and we're working out the details with that. Of note, I think it's well known that there's been an issue with people jumping the line and sharing sign-up links, and we are very shortly going to be rolling out a process where that'll be prevented, where only people who are given the link that's associated with them will be able to sign up with that link. So I think that'll resolve a lot of the issues that have come up with people jumping the lines, as we call it. But overall, I don't think I've worked so hard in my life doing something. But it's so important, and just the reception from those that have come through our lines it makes it all worth it. And the tears of people who have been inside for the last almost year, and getting a glimpse as they get that vaccine that I'm going to be able to see my family and my friends. It's really important. So sorry to get a little emotional, but it's I'm happy to be in this position and be lucky enough to help get Williamson County out of this pandemic.